A day after the city announced that 80,000 of its government employees will begin their return to the office, pushback on the plan came from all sides.
It's sort of like taking your foot off the brake before you've put the car in the park.
From medical professionals to public advocate Jumaane Williams and city council member Mark Levine, calls were made on both the city and state to slow down upcoming reopenings, including sports arenas and performing arts venues set to open next month, citing the ongoing race between the vaccines and the variants.
The variant first identified in New York City now itself makes up 40% of new cases, and that's pretty good evidence that it's a highly transmissible form of the virus.
We need to slow the pace of reopening.
While Mayor de Blasio insists the city will be enforcing its own safety guidelines for its workforce returning to the office in May, including mask requirements, he continued to express frustration with the governor's eager pace.
I am concerned that some of the decisions he's made lately, I think, are more and more about politics than about the health of our people.
Meanwhile, Governor Cuomo today announced the launch of the New York State Citizen Public Health Training Program, a first-of-its-kind free online course that aims to prepare New Yorkers for future public health emergencies.
It's 16 hours, and it will be the best 16 hours you've spent investing in yourself and your family and your community.
Also giving officials a peace of mind, the latest state numbers where positive cases and hospitalizations are dropping. To date, more than 8 million New Yorkers have been vaccinated. Still, Dr. Anthony Fauci, the country's leading infectious disease expert, did not exactly declare victory.
When I'm often asked, are we turning the corner? My response is really more like we are at the corner. Whether or not we're going to be turning that corner still remains to be seen.